There was a journal, one of the journals that we have, one of the, it talks about new innovations. And that year I remember that they had come out with 52 ankle, they showed the 52 ankle braces. None of them were like this, BioSkin. They're different ones, and if you see them, they're the plastic ones that had a twirl or a spin and design. The idea is almost like you do a high dye taping, and if any of you are familiar with the taping events, like ankle athletic taping, they're trying to mimic that idea. Nothing was quite like the TriLok, and the reason I like that, and no unabashed advertisement here, but just truly, prior to this, the one I used the most was the what's the one? The Sweeto ankle lock brace was probably the most common for a couple of reasons. First of all, my patients, the ones that I have, don't always tolerate the hard brace. So you have the air cast, air splint, those kind of braces, the hard braces on the side. That's okay, but now when you take a 19-year-old kid, he doesn't care. He's in his DC shoes and his little Converse. That's fine, but start to put it in you. If you're going and calling on patients, you're wearing your dress shoes and your dress pants. Are you able to wear a big bulky brace and go in there? You don't want to look that way, So you're taking the average patient, not only their everyday use, but their athletic use. So the one thing that struck me about things like a Sweeto brace is that it was smaller. So I wanted something that didn't have a large bulk to it. I wanted something that wasn't plastic and hard that the patient could do. The laces are terrible on the patient because it hurts. And if you've ever worn a high lace shoe that's close to the skin like that, it's not comfortable. It works, but to get it to work, you have to wrap it extremely tight, and then the laces aren't comfortable. And they try to obviate that problem by putting in all kinds of things. Something with Velcro works better. Now, you take another patient, say, who has rheumatoid arthritis, who has post-hip dysfunction. Their hands don't work. They can't tie and lace up. They'll look at, my girls will bring in something braced like that to a patient with laces, and they'll say, honey, I can't. Stop right there. It ain't going to happen. So the Velcro is a good thing. But more importantly, probably how this works is not only do you have the cross straps, but you have the innovation of the white strap in the middle. And the reason is I probably use this more often for plantar fasciitis and posterior tibial dysfunction. Those are my two highest. Next would be lateral ankle sprains. I use it acutely too, a lot. But more often in a chronic problem, it'll be the fasciitis and it'll be the post-tib dysfunction. And the reason that I like this brace, and the reason it was new for us, is that the patient can control this. They can control what's comfortable, right? So once you show them how to do it, they know how to pull it on tight. And as you wrap up and lift up to support the midfoot, your cross straps are supporting the ankle. And now you have the two things that we talked about in our pathology, the midfoot, that midfoot problem, but you're crossing the ankle joint. Remember, the post-tib tendon works at the ankle, and I'm able to pull the straps up and lift the arch at the level of the ankle and the midfoot. All right? So that's what makes this work, I think.